Hi, everybody. Welcome to Nurse Tech. Today, we have an exciting interview for you. As you know, Nurse Tech is a space for nurses to come together. We offer support, camaraderie, humor, in the trenches, talk, and lots of guidelines and resources for everyone, starting from nursing school all the way up to nurses with decades of experience. So, welcome. Today, I am joined by Marion Leary. Marion Leary is the Director of Innovation for the University of Pennsylvania's School of Nursing. She focuses on nurse-led innovation and design, thinking in healthcare. Her research focuses on cardiac arrest, CPR quality, and improving bystander response. Marion is a member of numerous nursing committees and associations, founding member and board of director for the Society of Nurse Scientists, Innovators, Entrepreneurs, and Leaders. The recipient of many awards, including maybe my favorite award I've ever heard of, the Geek of the Year. And without further ado, welcome, Marion. Thank you so much for doing this with us.
Well, thank you for having me. I'm really excited to be talking with you this morning.
Yeah, we haven't had a lot of speakers on here or interview guests on here that have talked about nursing innovation that are really like in the thick of it. So I'm super excited for people that are interested in what's out there besides bedside nursing. I feel like you are someone that they're going to have a lot to think about here. So,
Yeah, there's so many options outside of bedside nursing, and nurse-led innovation entrepreneurship is just one of many.
Yeah. I think it's so important for nurses to see how do you do that, and that there are actual, real, living, breathing people out there doing just that. Tell us how you got your start in nursing.
Yeah, so it was not a straight path. I never even thought about nursing, to be honest. I didn't go to college after high school, but worked for a while for a variety of nonprofit organizations and aid service organizations. And it's really while I was working in a residential program for people with HIV, AIDS, mental illness, and substance abuse issues that I met a nurse who really changed my path and changed my outlook on what nursing was and could be.
Yeah.
Nursing has like this weird stereotypical view in the public about what they are and what they do. And I had no idea. I thought it was just nurses working at the bedside who sort of took orders from doctors, and that was it.
Right.
And I got to know this nurse who was just incredibly knowledgeable, compassionate, autonomous, creative, innovative, and I immediately knew that was the profession for me.
Yeah.
And so at the time I was living in Boston and decided to start taking classes, all the prereqs you sort of need to apply to a nursing school while I was in Boston and still working. And then decided I'm from Philly, so I decided to move home back to Philly and really start looking about going back to college or going to college. But as soon as I got back, I still wasn't sure if nursing was for me. Like I said, I didn't really know what nurses did. I really did not want to work at the bedside. Being a clinical nurse was not what I wanted to do. And because I didn't know you could do anything else with a nursing degree, I kept sort of taking other paths. And so eventually, I don't know that I don't need to walk you through every failure I had, but eventually I saw a brochure that listed all the different, not all, but many different things nurses were doing with their degrees. And one of them was as a nurse researcher. And that was it. That all the stars aligned.
Yeah.
I've always loved science. I've always loved asking and answering questions. And so bringing together nursing and research, that was it for me. And so I applied to that program, got in, and sort of my life has taken off from there.
Yeah, that's cool. And that's such a great point. I think a lot of nurses, especially in nursing school, because you all get funneled into one track where you have to be, a clinical bedside nurse to graduate, and so you might not get the exposures to those other opportunities that are out there. So,
Yeah, it's crazy because you as a nursing student, that's all you learn and that's all you
right.
hear. Everybody tells you you have to go to the bedside after nursing
Yep.
school, and that was definitely not what I wanted to do. But
Right.
I figured I had to
Right.
to get into nursing. And actually, I had one professor say to me, "If you don't want to go do clinical after nursing school, you don't have to." And that
Yeah.
like blew my mind. I
Right.
actually did go work clinically after college, but I worked in the medical ICU for a very short period of time, and
Yeah.
then started doing resuscitation science research.
Yeah. It's so true though. I mean, because that's so exactly right, where people are like drill it into you that it's just you have to get your med surg year in, or people won't take you seriously. How can you research something that you yourself haven't been in the shoes of? But
Well, and they're not wrong. So I never would have been able to do the research I was doing at the level I was doing it with the people I was doing it with
mm,
had I not had that time in the medical ICU.
yeah,
It gives you so much street cred
yeah,
and knowledge and experience that
yeah,
you otherwise would never have. And even what I'm doing today, I would never, I just would not be able to relate to the
right,
clinical nurses in the way that I can
yeah,
by having that. I worked in the medical ICU for a year full time and then for 3 years part time. It
yeah,
just it just gives you that base of knowledge. There's no other way to have
right. And to
that.
know if like the applications of the research and innovations that you're working on are actually practical.
Right, and just how a health system works, or
Right. Yeah.
how like I was doing cardiac arrest research. If I had never been to a code or had never
Right.
coded a patient, how could I have even done that? And
Right.
the medical ICU where I work, we had the most cardiac arrest events of any other unit in the hospital. So like
Right.
I knew I knew what a cardiac arrest was. I knew how to code a patient, and I
Yeah.
knew what had to happen, and that really just helped in the research work. But
Yeah.
I'll say, I talk to so many undergraduate students and actually practicing clinicians who have no idea they can do anything else with a nursing degree.
Right.
They've never been told that, they've never been taught that, they don't
Yep.
know anyone else doing anything with a nursing degree other than working clinically. And so I think that right there is a failure in our education.
Yeah.
Because not everybody wants to be at the bedside, and
Right.
that's okay. Nurses are doing so many other things
Yes.
with their education and their degrees, and
Yeah.
we need to start promoting that.
Yes. I couldn't agree with you more. Um, what how did you get your focus in both your teaching and your research? What kind of led you there?
Yeah, like I said, I always wanted to do research. I never wanted to be a clinician. I actually, as I mentioned, was working in a variety of aid service organizations before
Right.
I went to school for nursing. And so I really wanted to do HIV/AIDS research.
Mm.
But while I was working in the medical ICU, one of my colleagues saw a job posting for a nurse research coordinator with this entity called the Center for Resuscitation Science. And
Mhm.
they thought it'd be a good fit for me, just as a way to get my feet in the door in
Yeah.
research, get some experience. It was sort of an entry-level nurse research coordinator position,
Mhm.
and I had no research experience at that
Right.
point. So I was like, sure, I'll apply and see what happens. I really just wanted to get into research,
Yeah.
and
Have research in the title. This is good.
right, exactly. And I didn't have to look for it. It sort of came to me. It was
Yeah.
perfect. So I applied and I got it. And I had never had any intention in staying in resuscitation. I really, again, just wanted to learn the process, get the experience, and then move on to infectious disease or, AIDS research. But I ended up falling in love with the work that I was doing.
Yeah.
Again, having been in the medical ICU, a lot of what I was doing was work in the ICUs in the hospital that I had already been working in. It sort of made sense. It was exciting. It was important. At the time, there was new therapies coming out that we were trying to
Yeah.
promote and research, and I had some just really nice colleagues, and it all just worked out. And there weren't a ton of nurses doing research in this area, so I quickly was able to, become my own sort of a nurse researcher, and then PI of my own grant, doing my own research agenda, and it just sort of flourished from there. And I ended up spending 12 years as a resuscitation science researcher.
Yeah.
And that's really where my innovation work started to flourish. I was looking at, by the end of my resuscitation time, I was looking at how technology and innovation can improve training and education for both in-hospital clinicians, but also lay responders.
Yeah.
And so it started to really bring together all of my passions: innovation, technology, health communication, social media, like all this stuff.
Yeah. Cool.
So, yeah.
That you bring up an interesting point about how you don't see a lot of, I hate to use the just nurse quote here, but in research, and using your nursing hat and applying it with your research. We talk a lot about nursing professionalism and excellence. How do you see your work or your start in research as promoting excellence in your field or just in nursing in general?
Well, like you just said, I mean, there are a lot of nurse research coordinators, right? People who are assisting with the research, especially in the space that I was in. So I was in this weird, like, biomedical research space that was led by all physicians in the medical health center. It wasn't through a school of nursing or anything. I honestly had no interaction with my nursing degree whatsoever. Like really during that biomedical research time, it was really always looking at stuff through the lens of biomedical research and the physicians I was working with at the time. And so I think, we need more nurses leading research. We need more nurses leading research in interdisciplinary groups. And so I think it was really helpful for the physicians and other interdisciplinary colleagues I worked with to be able to see what I was able to do with my nursing degree. I was, by the end of the work I was doing in resuscitation, I was sort of leading different committees. I was on the international guidelines writing groups, and on the AHA's writing groups for the American Heart Association guidelines, and all of these things as a nurse. And it was me and like 2 other nurses. That was it. And like 30 other physicians and a couple of respiratory therapists and paramedics. So I think as a profession it's really helpful, and this even goes with innovation and entrepreneurship. We need to be at the table. We need to show up, we need to do the work, and we need to be there. And hardly you won't always get invited. So you have to sort of show up. You need to ask to be there. You need to demand to be there. And that's sort of how it works. But luckily, the resuscitation community is incredible, and they're very interdisciplinary, collaborative. So that was really helpful. Not all specialties are like that. I feel like a lot of them still are very physician-centric, which needs to change.
I mean, as the people that are going to be delivering the care that you're designing, it's so important to be one of the voices crafting it.
Totally.
I mean, it's obvious.
And it's teamwork. Like that one discipline is not better than the other. We both bring different experiences, different knowledge, and different lenses, and so we should all be there leading. I think that's great. I think you answered my next question about nurses contributing to innovation and change, just the importance of being a voice. And like you said, can you I'm thinking of the part where you said you have to demand to be there. How does one do that in a way that doesn't, ostracize you from the group that you're trying to be a part of? I think, I've learned the skill of being, I'm trying to think of the right word here. being forceful. Forceful is not really the right word.
Like assertive,
Thank
or
you. Yes,
yeah,
coffee hasn't kicked in. I've mastered the skill of being assertive, but also being like nice and laid back and collaborative. And
right,
so, asking in a asking in a way that's not really asking. I'm not asking. Like, you need to have
right,
nurses here, and you need to have me here, and so I want
right,
to I want to come and be a part of this effort that you're doing, because it's important that we all work together. And
right.
I think partly it's building relationships, partly it's not taking no for an answer,
Yeah,
but also being like a team player. Like, if you're
yeah,
going to say you want to be there and show up, then you need to be there, show up, and do the work. And
yeah,
I rarely say no to things, for right or wrong.
yeah,
It's going to end up killing me. But, if I'm going to push for nurses to be at things, then
yeah,
I'm going to be at things.
yeah,
And I'm going to do things, and I'm going to do interviews, I'm going to do presentations, I'm going to do work groups. And,
yeah,
you got to do the work, and you got to
yeah,
show up. And so I think that's part of it too, showing
right.
up and doing the work.
Yeah. I think we talk a lot about the whole concept of nurses eating their young, a lot. And I think that phenomenon happens in other disciplines as well. So I think some nurses are sort of conditioned to be kind of this meek
Yep.
player because they don't want to get their heads bitten off about, what do you think you have to contribute to this, newbie. But
It's so true. And I see that all the time. Like,
yeah,
I talk to so many nurses who have all these amazing ideas for
right,
innovations and potential, like, companies and way to scale things up. And they're so afraid to take the step to do it.
yeah,
And they, like, I'm involved with the Nurse Hack for Health, which is a virtual hackathon. And I talked to a ton of nurses who just like, well, I don't know, like, I
right,
don't want to cause any problems, or I'm not sure if
right,
it's going to work. And we
yeah,
need to empower our nurses that they belong
right,
every place, everywhere.
right,
Everywhere that anything's happening, that
yeah,
the nurse should be there.
right,
Um, so yeah, I mean, it's true. We eat our young. We make nurses feel like they're, I don't even know, their knowledge
better
and
at being the
opinions.
coordinator than the leader of this discussion.
Yeah,
Yeah,
yeah, yeah, and we need to stop that.
yeah,
Like,
yeah,
1,000% need to stop that,
yeah.
like, yesterday.
Well, tell us about some of either the innovations that you've worked on or are working on, or are excited about, that are coming down the pike that you see happening and transforming the nursing industry.
Well, I'm going to go back to the Nurse Hack for Health. So, as you mentioned, I'm on the board of SUNCL, which is the Society of Nurse Scientists, Innovators, Entrepreneurs, and
Yeah.
Leaders. And
Okay.
at the beginning of the pandemic, we obviously saw that our clinician colleagues were struggling.
Mhm.
There wasn't enough PPE. There's a lot going on in the health systems with COVID. And so, in partnership with Johnson & Johnson and Microsoft and another company called DevUp, we started a virtual hackathon called Nurse Hack for Health, so that nurses could solve the problems they were seeing at the bedside related to COVID.
Okay.
And so the Nurse Hack for Health has just taken off. We just ran I want to say it was our fourth one this past weekend, and
Mhm.
we had over 800 registrants
Wow.
from 48 countries around the
Wow.
world, 35 states in the United States.
Yeah, cool.
And it is always incredible,
Yeah.
but I mean, it still is just incredible. The nurses who come to this are really looking for the things that we've talked about. They're looking for encouragement and
Yeah.
empowerment. They're looking to learn new skills. They're looking to meet a community of like-minded individuals who
Right.
are excited to lead in health and healthcare innovation, excited to lead the change that they want to see in the health systems at the bedside and in the work that they're doing.
Right.
And the for those who don't know what a hackathon is,
Yeah. Like me.
so hackathons are a quick-paced event that happens generally over a weekend. So on Friday nights, everybody gets together. It's not just nurses. So we've had engineers, designers, programmers, entrepreneurs, other healthcare providers. There were physicians and like I think EMTs and all sorts of people come together to try and solve for problems over the weekend. And so they pitch their ideas on Friday night. They form teams with people they don't know from all over the world.
Yeah.
And then throughout the entire weekend, they hack. So they we use the human-centered approach of design thinking to help guide the work. So they define their problem, they ideate, they start coming up with solutions and creating sort of these low fidelity prototypes of what their solution is. And then by the end of the event, they pitch to a panel of judges.
Wow. That's so cool.
Yeah, and we really want this to be sort of an upskilling event. So we have design sessions, we have one-on-one workshops on how to pitch, on what design thinking is. We have practice pitch sessions. We give them feedback. There's tons and tons of mentors and coaches who work with them throughout the entire weekend. It is an incredible environment for learning and networking and building a community.
Right.
And it has really, hackathons, nurse hackathons specifically, has changed my life and my professional life.
Wow.
And it has done that for hundreds of nurses from these different events.
Right. Because I can imagine if you're a nurse working at the bedside or wherever, and you have this idea that's like gnawing away at you, that you need to get out of yourself, like, I imagine it could be kind of a lonely experience unless you meet someone else who's like, oh my God, me too. This is what I'm thinking. This is what you're thinking. And like to be in an environment where you're just surrounded, like you said, with people that are going through what you're going through, but can collaborate and put the ideas together in a way that propels an idea forward is like, it must be like the coolest feeling ever.
Yeah, and that's exactly what happens at the hackathon. So one of our teams, sorry.
Oh, no, it's fine.
So one of the teams from this past weekend told the story about how they were talking to another nurse on LinkedIn about an idea that they had. And then separately, they didn't know each other. They were just chatting on LinkedIn. Separately, they both registered for the Nurse Hack for Health and then found each other because of the topic that they wanted to work on and formed a team and worked together through the entire weekend on the idea that they randomly were talking about on LinkedIn.
That's amazing.
It's crazy. Like to be able to find the same type of people, it really has helped, I think, a lot of the nurses who are feeling burnt out, feeling like health systems don't listen to them, don't understand the power of what they can bring.
Yes. Yeah. So, that's been a big theme in the talks that I've had with people is nurses feel like they have this impetus to do something, but they don't know where to channel the power, or to even know that how much they really have within them, and it might feel just like exhaustion and frustration, but channeled in a healthy or productive way. Like it's amazing hearing all the work that different nurses are doing with that sort of discomfort or uncomfortable feeling,
and we had a lot of nurses talking about that during the hackathon, getting very emotional about it. Like, these nurses are struggling. They're burned out. They're sad. They're mad. They're tired. A lot of them don't feel like their health systems get it, and it's like the last straw. And at least this weekend they had a space to share and to feel empowered and hopefully feel a little better. Like we're not going to solve all of the problems, but at least giving them a weekend together to be heard and lift each other up, I think it can't hurt.
Yeah, and provide a direction, a direction forward, not feel like you're stuck in something that you can't control,
For sure.
What is it, a virtual event? Is it in person or?
Yeah, it's a good question. Because of COVID, we've been doing them all virtual, but
Okay.
we're hoping, so we're hoping in early 2022 we could do an
Right.
in-person one. And we've been saying that for
I know.
18 months now. So we're
Yeah.
hoping the plan moving forward would be do maybe 2 a year, one in person, one virtual. There's pluses and minuses to both. I mean,
Yep.
the reach that we can get with the virtual events is like nothing we've ever been able to get in person, right? Like nurses from all over the world interacting together.
Yeah.
It's been just incredible. We've had teams in Africa and Israel. I think we had someone from Sweden and Ireland and like,
Yeah.
literally all over the world.
Yeah.
So, you know, we have to sort of see what 2022 brings.
Right. Well, I think as much as we all can agree that pandemics can go suck it, like at least like we have this
True.
common denominator that we can all relate to globally, you know.
Yeah.
I
Yep.
don't think there's no corner that hasn't been touched by it, you know.
Yeah.
Um,
Yeah, and you know, some positives have come out of it. Like the number of these virtual events now that have connected nurses
yeah.
around the globe has been incredible.
Yeah, amazing. Tell me how, if we have nurses that are watching, how should we go about encouraging nurses that maybe never even like considered this tract of nursing to pursue innovative thinking to make it something that could be part of their lives or careers?
Yeah, so you know, I have a number of thoughts on this. So my primary role, sort of, part of my primary
Yeah.
role as director of innovation is to help educate our faculty and students around what innovation is, what it means, what the methodologies are. So I
Yeah.
really feel like it has to start at the you know, base level of educating the next
Yeah.
generation of nurses
Right.
as leaders in health and healthcare innovation.
Right.
And we can't do that unless we're teaching them what that means
Right.
very early on. And so at Penn Nursing, we're really trying to infuse innovation throughout the entire curriculum from undergrad all the way to
Uh-huh.
doctoral level. And so I teach a course called Innovation in Health Foundations of Design Thinking, which is housed out of the School of Nursing, but open to every student across the university.
Yeah. Cool.
Either our upper level undergrads or graduate students can take this class. And you know, it just gives them, as the name says, that foundation of what human-centered design and design thinking is and how they can use it to think differently about the work they're doing
Yeah.
at the bedside or in the community or wherever it is they practice.
Right.
And so, you know, thinking about, we've been infusing it throughout the curriculum in many other ways in existing courses and through other programming. But then we also, for you know, the clinicians who are already out there working, we, in partnership with the Rita and Alex Hillman Foundation, put together a free open access course called Design Thinking for Health that
Okay.
anyone can use to learn about what nursing innovation is
Awesome.
and how to use human-centered design and design thinking in their work. And so,
Okay.
you know, it's a great resource for either nursing schools to use. They can take the whole curriculum and create a course around it.
Yep.
Or for health systems, they can take components of it and use it at workshops. It's
Say
really
the name of
their
the course one more time.
Design Thinking for Health.
Okay. Cool.
So it's designthinkingforhealth.org.
Okay.
And there's lots of resources on there. We created original lecture videos, original case study videos, podcasts, and there's a curriculum that walks you through all the different phases of design thinking. So anybody, like, we really built this for anyone to use. It has a Creative Commons license. You really can just take the whole thing
Awesome.
and teach your students with it.
Yeah, that's great. That's amazing. I feel like a lot of in nursing we're taught like this is the way we've always done it. Like, I mean, we, you know, evidence-based care, yes, but also like don't question me, you know. So I think for nurses it's a healthy thing to teach them to question things, but to question them in a not to complain about them, but to innovate them, like change them. If you have a better idea, like let's hear how you might want to change it. And oh, by the way, here's a framework for how you do that, you know, to legitimize it.
like it's okay to fail, like, and fail fast, but to do it in a rigorous, methodical way
Right.
where it's safe and you're learning, and
Yeah.
you have a methodology to help guide you. And
Right.
innovation is about taking risks and being creative and being okay with that, in this, again, structured way.
Right.
And so, that's one of the ways we're doing it. And also, to get to get nurses excited about nurse-led innovation, you have to give them opportunities.
Yeah.
And opportunities translate into innovations happening. And so we also at Penn Nursing are doing, we have our own Penn Nursing Innovation Accelerator program where students, faculty, or clinicians from our Penn Medicine hospitals can apply to go through our 10-month accelerator program where they receive funding, mentorship,
Wow.
and education to
Yeah.
help them take their developed idea
Yeah.
and either commercialize it or
Right.
get it out to their health system or whatever it is they want to do with it
Yeah.
at the end. But nurses want to do these things. They
Yes.
have these ideas. They just need the support and education and
Right.
mentorship and resources, and they need the time.
Yeah.
So what I've learned over the last couple of years is that it's going to take nurses a lot longer to do these things because they're working clinically,
Yeah.
they're raising families. They're also, a vast majority of them are in school, and they're trying to do this. There's so many things stacked up against them to make it easy for them to then say, oh, I have this idea and I want to create this company.
Right.
And that's a whole other full-time job doing that. And so you have to sort of be patient, know that it's not going to happen on an accelerated timeline, even though they're in an accelerator.
Right.
But be willing to just be there and help them along the way. Our
Yeah.
accelerator program is 10 months, but I've already decided I'm going to keep working with our teams until they don't want to meet with me anymore, because I think it's important that we stay with them and understand what that timeline is going to look like for these nurses who are just working in school, raising families, and doing a million other things.
Yeah. Yeah. Can you tell us, I mean, you're tapped into the ideas that are floating around right now and being actively worked on. Are there specific solutions that are being targeted right now to prevent nurse burnout or to, keep nurses in the field, nurse retention? That's like a huge trending topic right now.
Yeah, so the hackathon was all about that. And there were lots of ideas. A lot of stuff had to do with mental health for the nurses.
Yeah.
I'm trying to think of what the other, we had 16 pitches. So I'm trying to remember what.
Yeah. So in terms of the mental health aspect that you touched on, I mean, for us at NurseTech, we focus a lot about just connecting nurses with one another. So I feel like a lot of the healing work that needs to be done is just getting two people in the same space that have the same issues going on and just letting them talk about it. Something as simple as that can have a transformative effect on someone's day-to-day life, knowing that they're just not alone and all the stuff they're struggling with, the small and big details of it all.
Yeah, for sure. So one of the main things that came up from the hackathon, so there's a couple teams looking at nurse staffing and flexibility around that. And I've had multiple conversations now with folks about, if you want to keep nurses at the bedside, health systems need to start understanding that they need to be flexible in the way that nurses work. Nurses want to be able to, I keep using this Amazon commercial because I think it's brilliant. Have you seen the Amazon commercial where, it's just a list of I don't know, maybe 10 people, and one of them's I don't want to work on the weekends. I can only work Mondays, 3 to 5.
Yep.
I can only work holidays. I can't work holidays. And at the end, Amazon's we have a job for you. Come work with us.
Yeah.
That's what I heard this over and over in the hackathon. nurses want flexibility
Right.
in the way that they're working. And so I think that was a big issue that came up, was trying to come up with a solution for staffing of
Yeah.
health systems, and how
Yeah.
we can give that flexibility to our nurses.
Yes.
Um, there was stuff around, like I said, mental health and burnout, um, building sort of resiliency,
Yeah.
all these different things that I think we know about. We just need solutions to.
Right. Yeah. No, that is a huge issue. And having flexible solutions for staffing in the sense that, it has to happen in real time, because you
Right.
get call outs or people that are sick or
Yeah.
my kid needs to be picked up
Yeah.
at daycare or whatever. I mean, it's without feeling like you're being persecuted for having to take care of
Yeah.
your other responsibilities.
Right. Yeah.
Or come back to a job, if it
Right.
happens over and over.
Yeah.
Um, I'm just looking through here. I think we've covered so many of these. Are there any projects in particular that you guys are doing? Uh, let's see. Sorry. Yeah, I think we've sort of covered all these other questions here.
Well, so I can't. So you were starting to say there are other projects, and yes. So one of
Okay.
one of my big pushes has been around storytelling,
Awesome.
and using storytelling to amplify the work that nurses are doing. Going
Okay.
back to where I started, right? Like I had no idea what nurses did other than what I saw on television.
Yeah.
I think the vast majority of people have no idea what nurses do on a daily basis. And so at Penn Nursing, we launched a podcast called Amplify Nursing, which focuses on the things that nurses are doing around innovation, policy, research, and practice.
Okay.
We now host an annual nursing story slam.
Nice.
Do you know what a story slam is? Should I explain what it's like? A storytelling event.
Is it like the moth?
Exactly. It's like
Okay.
the moth. It's exactly that, where
Okay.
there's a theme and nurses come and tell their stories around that theme for like
I
6
love
or
that.
7 minutes.
Yeah.
It's been incredible, and it is a great way for people to see nursing through a different sort of lens. So that's been really exciting. And then I just got this really cool new grant through the SACS program for arts innovation here at Penn Nursing. We're working with a theater company, and we're doing ethnographic interviews with frontline workers, so nurses, physicians, and others in the hospital setting. And then they're going to take the interviews and create original plays with actors, and they're going to put on plays based on those interviews.
Wow.
So I think there's a lot of ways that we can get out to the world what it is that nurses do on a daily basis. Yes, we're at the bedside, but we're in so many other places doing so much amazing work, and we really want people to just know that.
Yeah. I could not love that more. I think that's incredible. And I think that's one of the most unique things about our profession, that you really can take it in so many different directions. And now with how connected people are with LinkedIn or the information just in this podcast alone, that there's so many things you can latch onto and follow and find your people. So
yeah, totally.
I think, that's
like we said before, like, nurses need to be taught that. They need to be taught that there are so many things that they can do with their nursing degree.
Right.
Yes, we need nurses at the bedside, but we need nurses in every place where anything's happening.
Yeah, I agree. I think it's so common too for nurses when they feel burnt out to just automatically think like, all right, I'm a, BSN nurse at the bedside. Now I'm going to go get my master's and be a nurse practitioner. And now I'm going to, there's like this elevation track that you follow, but there's so many other options to pursue. If you just have the right vision in mind, or if you have the right people to connect with, it's really incredible. Well, I think that's a great place to wrap up. Is there anything else that we I think we kind of wove our own track through this, but is there anything else that you wanted to speak about that we didn't touch on today?
No, I mean, I think we got most of it. Thank you for having me. I mean,
Yeah.
I'll just say that, I could have never imagined what I am doing now when I was little. I could
Yeah.
never have imagined what I'm doing now when I started nursing school. So,
Right.
if you're out there, you don't know, you have a degree in nursing, you don't know what else there is to do. Just know when the world is your oyster, you can do
Yeah.
anything with a nursing degree.
Yeah.
Um, yeah, it's the possibilities are limitless.
Yes. I could not agree more. And I'm sure that you are speaking someone's love language out there. So if there's people that are like hanging on the edge of their seats and just riveted and can't wait to get to all the, different programs and links that you've mentioned, we'll provide those so people can follow it and get to where they need to be. But thank you so much for the work you're doing. It's so exciting. I'm going to definitely go poke around in all my free time.
Well, thanks for having me. I really appreciate it.
Yeah, yeah. All right, cool.